Hi everyone. Today I'm going to be talking about the high deductible plan G. And the high deductible plan G is basically catastrophic coverage for Medicare. Now, it's a lot better than that. I hate saying that because it sounds like, oh, this is just for catastrophic. But let me get into the somewhat of the plan details. And I'll start with a little story about myself. So about 10 years ago, I've always paid for my own health insurance. About 10 years ago, um, I was on a high deductible plan from Aetna, and I don't really know anything about under 65 or I, I sell Medicare insurance. I do not work with insurance for people that are non Medicare recipients. So I really didn't have a clue about how the plans worked and the ins and outs. I had to actually get my own broker for that. And when I called Aetna and I spoke with them over the phone, and asked about their plans. I had a plan. It cost me $125 a month. That was the premium. So I pay that every month before I do anything. If I never go to the doctor or hospital, I still have to pay that $125 a month. Then I asked the woman, how much is the deductibles and copays? And of course, she told me there's a $3,000 deductible. Really, the conversation that I had with her is, so if I get hit by a bus and I go into the hospital for 6 months, how much is it going to cost me? And she said, besides your premium, it will cost you $3,000. So that was the high deductible back then. Um, so the high deductible plan G, the way that it works is somewhat similar. It's not exactly the same way. But with your regular plan G with Medicare, it covers outpatient and inpatient services, meaning doctors and hospitals, except for a $203 a year deductible. So with the Plan G, you're going to pay the first $203 to go to the doctors or outpatient services. Then, once that's done, you won't pay anything, no copays or deductibles to go to the hospital or doctor's office for the rest of the year. So basically, you're going to pay your premium. So let's say your premium is $140 a month. You're going to pay that every month no matter what. And then for the regular Plan G, once you pay that $203 in 2021 for doctors or anything that has to do with Part B, which is doctors or outpatient centers and so forth, then you don't have to pay anything when you go to the doctor or hospital for the rest of the year. So really it's just your premium and $203 for the year. I don't know why, it's such a small deductible, but that's the way it is. The high deductible plan G, let's just say your premium is $50 a month or even $70 a month. That will be your premium. So let's take $70 a month. That's on, might be on the high end. Depends on where you live in the country. So if you take $70 a month, the premium that you're going to pay, no matter what, you're going to pay $840 for the year in premiums. That's just to have the plan. Now, the deductible on the high deductible plan G is $2,370 for the year. So what that means is, let's say something happens and you have to go to the doctor every week and you have to go to the hospital 3 times a month. You'll pay that first $2,370, and then you won't pay anything to go to the doctor or hospital for the rest of the year. Now, you'll still have to pay that premium, of course. So if your premium is $70, you'll take that and it'll be $840 that you'll pay for the year no matter what. You'll pay that $2,370. That will be your high deductible. Then you'll pay zero after that except for your premium. Now, the total out of pocket for that, if you do the math, the calculator, is $3,210. That will be your total for the year, period, no matter what you do. Now, the one thing about the high deductible plan G is it does not cover prescriptions. So you have to add that in, and it doesn't cover vision, dental. If you want to get eyeglasses and so forth, you'll have to get a separate plan for that. But when it comes to hospitals and doctors, your medical coverage, you have to just take your premium, and we'll go off of $70 a month. It's different for everybody. It's different for males, females, what zip code you live in, and that sort of thing. But let's take $70. That's $840 for the year. That's your premium, and then you add on the, if something were to happen, if you never go to the doctors or the hospital, you don't do anything, you just let that card sit in your drawer, and you're like, I'm healthy, I'm the healthiest person in the world. I'm not telling you to do that, but if that's what you do, that will be the most that you pay all year, except for if you have prescriptions and so forth. It'll be $840. But let's say you use it to the fullest. The most that you will pay out of pocket is that $3,210. So it's kind of nice to know that what your most out of pocket will be, so that you get a feel for it. And a lot of people like this, because if people are healthy and they don't want to get on an Advantage plan, because some people, Advantage plans right now, there's zero premium plans and there are out-of-pocket costs. So it's kind of like, it works somewhat like the Plan G. I mean, it's totally different, but you pay as you go. And that's kind of the way the Plan G is. The high deductible Plan G. You have a smaller premium, but then you will pay that deductible and so forth as you go to a max out of pocket. And so a lot of the PPOs and the HMOs for the Medicare Advantage plans, they have a max out of pocket. And I'll just use roundabout numbers to keep it simple. But let's say the max out of pocket is $7,000. Then they also have a max out of pocket if it's a PPO for out of network that could be $10,000. So the max out of pocket is much higher, with the Medicare Advantage, but you might have a zero premium. So some people will get a Medicare Advantage, get that zero premium, go to the doctor twice a year, pay their $25 copay or whatever it is, and that's all they pay for the year. But the one thing about the high deductible G, the reason why people might not want to get on an Advantage plan and get on that high deductible Plan G is because if something happens when you're on an Advantage plan, if you want to get on the any of the Medigap plans, which would be G or N or any of these letter plans that you hear about, you're going to have to go through underwriting if you're not in your initial enrollment stage, and then they could reject you. So let me give you a scenario. You don't want to spend the money on a Plan G or a Plan N. Let's just say Plan G is $150 and the Plan N is $120 for whatever age group you're in or wherever you live. You say, you know what, I'm healthy, I don't want to pay that. It's too much money. Or let's just say it's even more, $200 a month for one of those plans. So you decide, well, I want to look at the Medicare Advantage plans. So I have to go through and look at what are the copays, what are the deductibles, what is the premium for the plan, what is the scenario for the doctors and hospitals out of your state if you travel and that sort of thing. Then you'll look at the high deductible Plan G and do a comparison. But one of the things, the key thing that I tell people is if you want a Medigap plan and you want something inexpensive because you don't want to pay for all these premiums, most of the time they say, I've been to the doctor once, all my levels are good for my blood levels, whatever it is. Sometimes they want to get on a high deductible Plan G instead of the Medicare Advantage plans. That is the number one key that I see for people that want that high deductible Plan G. So if you have any questions or comments, leave them below, or you can go to my website, which is on the screen throughout this whole video, and my phone number. And I'll see you at the next video. Thanks for watching.